So this is for the treatment of a patient with a fractured hip. It is not the treatment for a patient with a fractured pelvis or a fractured femur. For this, you will need 4 cravats, a blanket, and you will also need an orthopedic stretcher. The first provider will take stabilization of the hip. The second provider will check for circulation, motor, and sensory. At this point, you will place 4 cravats under the bend in the patient's knees. You will slide 2 to above the knee and 2 below the knee. Once your cravats are in place, you're ready to place a blanket roll between the patient's legs. It is important that the blanket be folded so it will extend all the way to the top into the groin and then down to the bottom of the patient's feet. Do not make sure that your blanket is not too short. It must extend the full length. If you find yourself having trouble getting the blanket all the way up in, it is acceptable to move the uninjured leg out. Place your blanket in place, and then move the uninjured leg back in against the blanket. Once you have the blanket in place, you will begin by securing the top strap. You will work proximal to distal on this splint. If you tie your knots on top, over top of the blanket will provide the padding. You want to assure that you're not tying directly over top of the patient's knee. Depending on how much excess blanket you have beyond the patient's feet, before you secure the bottom 2 straps, you will want to look at your blanket and fold up any excess up into between the patient's feet and lower legs. This helps to maintain the natural position of function of the legs. At this point, you are ready to assess circulation, motor, and sensory. You're now ready to place your patient on an orthopedic stretcher. You will keep the orthopedic stretcher together to measure the device. Never take the device over top of your patient. You always want to move it around your patient. You want to assure that the length of the device goes above the patient's head and below the patient's feet. You will either have a rotating ring or a red pin that you will need to unlock to allow you to adjust the length of the splint. Once the stretcher is appropriate length, you want to pull out to make sure that it is locked into one of the holes. Once you're sure it is engaged, you can disconnect any straps that may be connected on the device, and then separate using both the locking pins at the top and the bottom of the stretcher. Again, you should not lift the part over the patient, so take it down around the patient to get half on the other side of the patient. The head end gets connected first. You can angle the splint out as necessary to pull in the head end and get the head end secured. Again, you want to make sure that it snaps in place. At this point, you are ready to begin working the device down the patient, sliding the device from both sides, working it underneath of the patient. It is acceptable to grab the patient's arm and pull to the side that you're on to rotate the patient's shoulder, allowing you to more easily slide the device underneath of the patient. With patients who are heavy, it is important to make sure that you do not pinch the patient as the device is coming together. You will continue to work until you are able to snap the splint at the bottom. Do not lift the patient with an orthopedic stretcher until they have been strapped. If you have a device that has straps pre-connected, buckle them into place. If not, you can use 9-foot straps or quick clips if your device accepts them in order to secure your patient for lifting. The orthopedic stretcher is not a carrying device. It is only to be used to lift the patient and place the patient on the cot.